Pelvic organ prolapse impacts 1 in 4 women, and a lot of these women are only offered one solution when it comes to treating their symptoms. They'll complain of symptoms such as vaginal heaviness. They may even notice a bulge descending from the vaginal region. In some cases, women may complain of pain as well. But the only solution a lot of these women are offered is surgery. I want you to know that there are conservative treatments that you can do to help manage the symptoms of pelvic organ prolapse. And these conservative options include physical therapy and also using a pessary. So before we talk a little bit more about what physical therapy and a pessary can do for you, let's learn about what pelvic organ prolapse is. The pelvic floor is responsible for supporting the pelvic organs. In women, that includes the uterus, your bladder, and the rectum. Now, notice I said the pelvic floor and not just the muscles, because a lot of people have the misconception that the pelvic floor only consists of muscles. A good portion of it, yes, is muscular based. However, you also have static structures like the ligaments there that can help provide support for these organs. When the pelvic floor is not able to effectively support these organs, that is when women begin having symptoms such as heaviness, and they may even notice a bulge in this region. The pelvic floor muscles and ligaments, they're responsible for supporting your bladder, your uterus, and your rectum. And when they're not able to do that, those structures can actually begin to descend downward, causing pressure in that vaginal region. It is possible to have a prolapse only involving one of those organs, but it's also possible to have a prolapse involving multiple of those organs. The type of prolapse itself is going to dictate the type of treatment that is needed, especially when it comes to properly fitting someone for a pessary. A pessary is a device that you can insert within the vaginal region to help support these structures. Now, the purpose of the pessary is to help provide a little bit of support so that way now individuals are not having these symptoms. A pessary can also work really well alongside of physical therapy. Because let's say someone's having a bulge where they notice it's actually protruding outside the vaginal entrance. In this case, the muscles are not able to effectively contract to help lift and provide that support, no matter how many Kegels you do. But if you involve a pessary, so now a pessary is able to support these tissues, and now the muscles can come underneath those tissues to provide that support. Now strengthening can be more effective. So physical therapy is a wonderful component to utilize alongside a pessary. There are times where physical therapy alone can help manage these symptoms. Other times, additional support involving a pessary can be extremely helpful for women. Now I just want to show you a few different pessary options. With these pessary options, like I said, it depends on the type of prolapse you have as to what type of pessary you're going to receive, because the pessaries are going to provide support in different ways to help manage the symptoms that you're having and also manage the type of prolapse that you have. It's important to note that each pessary has a unique function, and when it comes to the individual, it should be properly sized to that woman. It's not one size fits all with these pessaries. There are some over-the-counter pessaries but even then, those typically have multiple sizes or a way to expand if need be, so that way they can fit the unique anatomy of each woman. With the pessaries that I'm going to show you, you're going to notice that these are some of the larger sizes simply because they show up better on camera, and I want to make sure that you can at least get a good idea as to what they look like. Each pessary I'm going to show you is medical grade based silicone. And because of the pessary's medical grade silicone, it's something that you can leave inserted for a certain amount of time. The reason why I say a certain amount of time and not an exact number is because some manufacturers, depending on the pessary type, indicate the pessary should be moved every day. There are other times where you can leave a pessary in place, generally for 8 to 12 weeks at a time. Each time the pessary is removed, you want to clean it with a mild soap using water and then let it dry prior to reinserting the pessary in order for you to use it. With the pessary, there's some women who may need to use the pessary for the duration of the day and then removing at night if they need to remove it for that day, or even leaving it in place until the provider says it's time to take it out. There are other women, depending on what their symptoms are, they may only need their pessary for certain activities. So this is a conversation that you will need to have with your provider to make sure that your needs are best addressed. But now let's take a look at some different pessary options so that way you'll know what's out there and you can start having this conversation with your provider, especially if you're looking to try to avoid surgery. So the first pessary I have here is a ring with support. Notice that this one has the inner webbing on the inside. So that is a support portion of this pessary. Otherwise, if it just had just a ring around, this would simply be a ring pessary. It is possible to use a ring pessary without the support and with support. It's based upon how much support you may need. With the pessary, it is flexible, so you're able to bend it so that way when you insert it, and once it is inserted within the vaginal area, you would simply push it in and then it would fully expand. With it being fully expanded, you should not feel the pessary on the inside, as meaning that it should not cause pain. Yes, you may be aware that something is present, but it should not be painful. If a pessary is not properly fitted for you, then you may notice that you feel it shifting and moving because it's too small. But it's also possible for a pessary to be too large, and that can cause discomfort and even breakdown of the vaginal wall tissues. So make sure that you are properly fitted, and make sure that you ask your provider, or at least let your provider know if you have any questions or concerns. So that is the ring pessary with support. This one here is a disc pessary, and this one has an incontinence knob. So it is possible to use a pessary as well to help with incontinence, because this little knob here will press against the urethra. So that way you have kind of a stopping mechanism if you're noticing that you're having bladder leakage. Just as the other one, this one is flexible as well. So that way you're able to insert it. Once inserted, it does fully expand. So that way you can get the support that you need with this disc with a knob. This pessary is a ring pessary with a knob. So this ring pessary with a knob has support as well. You can see the inner webbing. So this is simply a smaller ring compared to the one I showed you before. They come in different sizes, so that way it fits your anatomy. And with the ring pessary here with the knob, the purpose of the knob is the same thing for incontinence, to help press against that urethra, so that way you have better control of the bladder. And this one is a donut. It looks just like its name. With the donut, same thing. The donut, it is flexible. You're able to compress it so that way you can insert it within the vaginal region. This here is a larger size. All of them come in different sizes, and the support that you need will determine the size as far as like your individual anatomy, and the support you need also will determine the type of pessary that is needed. So remember, it's not one size fits all, but it is based upon your anatomy. So they should be measuring you to make sure the pessary fits properly, and then determining where they notice the movement will determine the type of pessary that you're using. All right, and then the next one I'm going to show you here, this is a Gellhorn. This is a short stem Gellhorn. There is a longer stem, which will come out to about right here. With the Gellhorn itself, this one is usually one that is managed by the provider. There are some individuals, there are some women that are able to manage this one on their own. The reason why I say this is usually managed by the provider is because it can be a little bit more tricky to insert and remove. So generally speaking, when I see women who I've either fit for a Gellhorn or who have used a Gellhorn, the provider normally leaves it in place for 3 months, those around that 12-week mark, and then they'll remove it, they'll clean it in the office, let it dry, and then they'll reinsert after they inspect all of the tissues, just to make sure that everything within the vaginal region is still looking as healthy as what it should. And the last pessary I'm going to show you is a cube pessary. Once again, this one here is a larger size, just like the donut was. This cube pessary is one with drains. You can see the little holes there. So when the cube has drains in it, the suction on the cube is not quite as strong. And yes, I said suction because this one actually will suction and adhere to the walls. So that way you can get the support. The Gellhorn will have a suction-based component as well. And with the cube, it does compress. So that way, as you go to insert it, you're able to compress, and it does expand once it is inserted within the vaginal region. And when this one's in, you would make sure you would push it up, so that way you would have the support and it's not just sitting close to that vaginal entry. But that at least gives you an idea as to different pessary types. These are just a few of the pessary types. There are lots of different options. And the type of pessary that you are fitted for should be based upon what they're noticing as far as the area of movement and also the complaints that you're having, the type of symptoms that you're experiencing, so that way you can get the best support. There are times where you may try one pessary and it worked great from the beginning, and there are other times you may try a pessary and that you decide this one itself I'm not all that comfortable with, and you can speak with your provider to see if there's another pessary option that will help address your needs as well. Well, I hope that at least gives you some information as to what you can do when you notice that you're having a prolapse. Because yes, physical therapy is a wonderful option. And at times, physical therapy in conjunction with using a pessary can be extremely beneficial for women.